Good morning, doctor. How are you doing today?
Doing well, thank you. Good morning. Thanks for having me.
Thank you. So, by the way, for the sake of my viewers, I want you to meet Dr. Ifueko Okundaye,
Hi.
internist and also practicing nephrology. She's a nephrologist as well in the state of Wisconsin, and been practicing for over 25 years to be moderate, and still actively in practice. And doctor, you probably look about 35, if I may
Thank
say.
you. You're kind.
All
Thank
right.
you.
So I have a question, something I think my viewers want to know to help them prepare better for their visits with you. A lot of our patients, go see their doctor and come back with no result. And then you ask them, so how was your follow-up visit? And they go, the doctor didn't say nothing. They just said, okay, see you next month. And you're wondering, but you went there with a something in mind, right? So I want them to hear from you. Okay, what is this they are supposed to be having ready? How do they prepare? How do our patients prepare to go for their doctor's visit?
That's an excellent question. You are
Thank you.
correct, actually, because from the patient's point of view, for those of us that have had the, um, I would say, blessing of being caregivers for
Mhm.
our patients, it's a common scenario where they come back
Yeah,
from the doctor's appointment and they have nothing to report. So I think that's a pretty good question. Um, as I think about it, I think that how the appointment goes depends on what you put into it, you being the patient. It starts with the
ah,
patient feeling
mhm,
um, that they are a part of their engagement with the doctor and that how they feel about their health is as important as what the doctor tells them. So if you buy into that idea that I am an important player in my health, I'm
mm,
going to be better prepared. The bottom line to trying to maximize your doctor's visit is education. So
mm,
every time we encounter a patient, whether it's my elderly parent or it's a patient in the office, we should
mhm.
always educate them because the next time they learn something, they need to build on what they already know. But it starts with
Absolutely.
what they know.
Yes, yes, yes.
So, somebody has to know what high blood pressure is so that when I say to you, your blood pressure of 150 is too high, I would like to increase your meds so it makes sense to them. So educate, educate, educate. It can never be too
Absolutely.
much. It can never be too much. So let's start with just the basic education, engaging your patient or your client or your parent or your loved one in any situation. You educate them. Then, when they're going for the appointment, the next most important thing is what was the reason that appointment was made? It
Mhm,
usually is made for a particular reason, at least in
mhm,
the doctor's mind. So you need to
mhm,
be aware why that appointment was made.
mhm.
And if there is nothing wrong, you should be saying, well, why do I need to come back? It's part of that
Yes,
engagement,
yes, yes,
you
yes.
see? Because if you ask that question, you are saying, there's nothing wrong. Why do you need me to come back? So then the
Mhm,
doctor has to verbalize. So again,
mhm.
I'm encouraging our
Yeah,
patients to speak up.
yeah,
If you have a reason for the appointment, then you know what you bring to the table. If
yes,
this is a follow-up for high blood pressure because med changes were made at the last time, then it helps for you to come back with a log of your blood pressures and what time of day was taken. And if
mhm,
you miss your medications anytime, make a note what days were missed.
mhm, mhm.
If you took your blood pressures, have a manual calendar or better still, a computer log. People have different levels of savvy, computer
Mhm.
savvy. So
Yeah.
some people might have a printout or bring their equipment to the doctor and be able to say, on the last 2 weeks, my blood pressures have all been 130/70 or lower. That's
Mhm.
very helpful.
Yeah. Okay, so now I know that some patients are going for their annual checkup, some are going for maybe every 6 months, or some are going for follow-up from a medication change or stuff like that. So it is important that they know why they're going in. That's what you just said. And
Yes,
when they go in, they need to know that they need to go in there with something in mind that they're going for. They need to know that, oh, I'm going up for my follow-up for my diabetes, and I have to
correct.
take my blood sugar recording for the past few weeks or months, and also a list of all the medications that they have been taking. Some of them may not be, some of our patients may not be literate enough to write down their medications. However, it is still okay to take their bag of medications
Absolutely. That
along
is
with them
correct.
to the doctor's
Yes.
appointment. So the doctor can review all of the medications alongside with what their findings are for that visit. And
That if forgive me for interrupting, that is very important because another common scenario, and I see this practically every day. I had a patient in the emergency room yesterday morning who I was admitting in the context of a stroke, and this
mm,
patient's blood pressures were evil high. So that
mm,
doesn't surprise me in the context of a stroke. But
mm,
as I went through the medications, I spotted a medication that's known to cause high blood pressure.
mm,
And the patient is taking it for a different reason.
ah,
So, yes, so when you go through the meds, it's not only important to say, here's what has happened since you gave me this, but here
mm,
are other medicines that other doctors have since started me on. So that's the
perfect.
importance of bringing your medications along.
Great,
There
great
might be
point.
things that are antagonizing your treatment, and you don't know it,
Yes,
but your doctor would know.
yes. Very great point indeed. Because there are some patients that, they go see their primary care doctor, but they also have a cardiologist, and they also have a nephrologist. They have other specialists, that they're seeing. And one medication in one area can also affect medication in another area of their life, but we're treating one person, you know.
Correct. And that one person is the primary care physician. So
Yes.
every time you go and you're asked what are your medicines, you need to bring all to the
All of
table,
them from your different
especially.
specialists. Okay.
Exactly. That's very
Yes.
correct.
Yes. Now, I really need to stress this point that because you're going to see your cardiologist doesn't mean you don't take your asthma medication or point out what it is that has been changed in your last appointment. Because some patients seem to think, oh, that's not my cardiologist's business. I went to see that one and they're doing something different. And I went to see this, they're doing something different. All the doctors need to be on the same page as to the care that you're taking because everything affects the one patient. It goes into the one person.
Yes, you as a patient need to be your own strongest advocate. Doctors are trained to make sense out of what they have in front of them, but they cannot
Absolutely.
look at you and tell. So you have to go in and give them the information to work with.
So the doctors are not psychics.
Oh, you got that correctly. That is absolutely correct. No, if a doctor looks at you without asking questions and tells you
Mm,
you're fine, go away, be
mm.
very worried. They have
Yes,
to use information that you feed them,
yes,
match it to
yes,
what they get from checking you out and from
yes,
the lab test results before they can tell you you're doing great or
yes,
you are not doing so great. So, yes,
yes,
your input
yes.
is a part of that assessment.
Absolutely. And I understand that, these days in healthcare in this country, United States of America, the caseload of patients that a doctor needs to see or a nurse needs to see is very unrealistic. And for our patient who's listening to this broadcast, they should not be a victim of such circumstance or situation. You are your best advocate, like you just said. So when you go to see your doctor, don't be intimidated, right, by the doctor wanting to move on. Just please go straight to the point to why it is you're there and what the things you've been experiencing, has been. So it is okay. And in fact, we should expect that the patients have a list of the things they want to ask their doctor,
Very correct. That is
Yes.
absolutely correct. And,
Okay.
if you leave it to chance, there is a chance that you don't remember to say it. So it's
Absolutely.
important to go with a list and share that with the
Absolutely.
doctor. Yes.
Absolutely. And one last question on that note is, now some patients take it to the other extreme and say, oh, I'm going for my annual checkup or for my doctor's visit. It doesn't matter what the visit is, but then they want to go to the doctor's appointment fasting, thinking, oh, the doctor might draw a lab work or something, while it is okay, but if that patient is a diabetic and not and they're trying to go there fasting and their appointment is at 2 o'clock in the afternoon.
Well, there's good and there's bad. You have to do what is best for you with all the safeguards in place.
Yes.
The scenario you described, I can see the person's blood sugar being 55. And
Mm-hmm.
it's not unusual that you get calls to the labs, not only because people faint from blood draws, but also
Mm,
because they're dropping because they fasted too long. That's
mm.
why you hear the call for help in the lab, in the
Yes,
hospital.
yes,
So,
yeah.
you do what's right for you, but though, within reason kind of thing.
Yeah, yeah.
And the other thing that I would like to add is if there is something particularly pressing
Mhm.
about a patient where family is really concerned, it's always a good thing to take an advocate along with you because
Oh,
two
yes,
ears are
yes,
better than one.
yes, yes, yes. That's great. That's a great point. Um, well, I think that's about it. I thank you so much, Doctor. If I have any questions coming from my viewers, I know where to find you. Can I pull on your expertise sometime?
Certainly, yes. I hope that we have a chance to meet again and chat again. And I hope that your viewers find that helpful. Thank you for inviting us.
I appreciate it very much, Doctor. Thank you.
My
And
pleasure.
in fact, it's your caregiving spirit that is making you want to give back in the way that you're doing right now. Thank you for your big heart, your humanitarian spirit to help others. Thank you. My time is running out, and I appreciate your time. Thank you, Doctor.
It's my pleasure. Thanks for having me.
I like to say one quick thing on that whatever the situation is when patients are dealing with situation, prayer always helps. As a Christian nurse organization, we always put prayers in our daily activity for our patients. And we
Very
pray and thank
important.
God for you, Doctor. Thank
Thank
you
you
so
so
much.
much. I appreciate that
All
and for
right.
your patience as well. Thank you.
Okay. Thank you. Bye-bye.
Bye.
All right.